My name is Allison Solo, and I am joined by,
Christina Mattingly.
and we are going to present a community analysis on West St. Petersburg, Florida. The objectives of this analysis will be to provide a brief historical overview of the city of St. Petersburg, providing a community analysis of West St. Petersburg's structure, population, health-related resources, environment, government and public policy, and its community needs and issues. Peter Demons, a Russian aristocrat, brought the railroad to this area in 1888 and officially named the area after his hometown of St. Petersburg, Russia. This railroad was built mostly by African Americans, which ended up staying in the area. St. Petersburg became incorporated as a city in 1903. It was not until the 1920s that St. Petersburg began to grow as a tourist location, and with the invention of the AC in the 1950s, more retirees came down to enjoy the warm weather. In the 1970s, Tropicana Field was built, and the area around 22nd Street South became a vibrant African American community. In the 1990s, downtown St. Petersburg began to integrate and transform into a neighborhood hotspot. St. Petersburg remains a vibrant community and is a top tourist destination due to its warm climate, sandy beaches, and culturally diverse downtown. Over 900 events bring over 10 million people to the area every year.
The structure of the community includes aspects such as the homes and housing options, roads and transportation options, places of worship, and options for low-income and homeless individuals. Regarding homeless and lower-income housing and supplies, there are 46 low-income housing apartment complexes for affordable housing rent, with an additional 874 subsidized apartments available in West St. Petersburg, as well as rent assistance and vouchers. Food pantries are harder to find but available, with the large majority being housed within churches. Low-income transportation options include the PSTA bus system, which is widely used and popular in this area. Those needing medical transport or wheelchair transport have Care Ride, the PSTA DART program, and the Florida Commission for the Transportation Disadvantaged. Between these options, finding transportation for anyone is possible. There is also a number of taxi services that run in the area, as well as Uber and Lyft. Houses of worship for many denominations are all around West St. Petersburg, including Catholicism, Islam, Judaism, Presbyterian, and many others. Regarding housing, the physical condition of certain areas and neighborhoods are in need of massive improvements. There are multiple neighborhoods that are severely low income and have not been updated in many years. The general upkeep of these areas is minimal to moderate. Over half of these areas are renter occupied, and half of residents attest to living paycheck to paycheck and unable to dedicate money to home upkeep. The city government has tried for many years to overcome these issues, but without fixing the low-income issues within these areas, it seems to be a revolving door of money with no long-term results. While these areas are in need of assistance, other areas such as Central Avenue, downtown, and the Tyrone area are well kept because they are tourist attraction areas. Roads are well kept, new building construction is continual, and stores and homes are well kept and appealing to the naked eye. For transportation, there are many main roads for getting around West St. Petersburg. These include Tyrone Boulevard, Alternate 19, US 19, and I-275. Construction on these roads are minimal, or try to be kept to a minimal, compared to many surrounding cities and roads. But side roads are very often being worked on, ranging from minimal delays to full detours for days, weeks, or months. Again, the condition of the roads is similar to that of the surrounding areas. The low-income areas' roads have more uneven areas and potholes than the Central Avenue and downtown areas, which are repaired when needed and well kept.
At the last census, the population numbers for St. Petersburg City, which is a part of Pinellas County, or 244,769 people. There is a definite fluctuation in numbers depending on the season, as approximately 80,000 residents stay in Pinellas County less than 6 months out of the year. The population race findings for the entire area of St. Petersburg are 1/4 being African American and close to 3/4 being Caucasian. The area of West St. Petersburg reflects these findings. The average age in the area varies from middle age to senior. A little more than half of the population is in the workforce, which could be considered a hindrance to society with lack of employee contribution. Another issue noted in the population is the low number of high school graduates, only 27%. This issue could be contributing to the reason why there is a high number of families below the poverty level. Approximately 1/3 of St. Petersburg population is below the poverty level. Of the top 10 diseases, the top 3 are sexually transmitted diseases. The leading causes of morbidity and mortality are no longer infectious diseases, but are chronic diseases, accidents, and violence. According to the Florida Department of Health, 30% of Floridians are sedentary, whereas 26% of Pinellas County adults are sedentary. Even though Pinellas County is lower in sedentary lifestyles compared to the state's numbers, it still is a large amount of its population at high risk for developing health-related problems. St. Petersburg has an older demographic, and with an older demographic comes more healthcare needs. St. Petersburg's leading causes of mortality are cancer and heart disease, both which have lifestyle and environmental components. Pinellas County has a 5% higher incidence of lung disease compared to the state of Florida, and a 1.3% higher incidence of heart disease compared to the state of Florida. Availability of health-related resources is very abundant and acceptable, with many options available, making them affordable. There are approximately 20 nursing homes or ALFs in the West St. Petersburg area alone. There are approximately 7 home health agencies, 10 various medical clinics, and 14 home aid services. There is one major hospital, and that is St. Petersburg General Hospital. It has an emergency care, inpatient care, and a labor and delivery unit. There are 8 walk-in clinics, 1 urgent care clinic, and a dozen or more primary care clinics. The largest hospice in the county, Suncoast, is in West St. Petersburg. This area also has multiple Bowley Center locations, which help provide services to the mentally disabled or psychiatric needs community. As evidenced by all the resources discussed, there is no problem with this community having its healthcare needs met. This area has most, if not all, healthcare needs met, including numerous discounted grocery and drug stores for basic personal health needs. The Healthy People 2020 objectives chosen for this community are sexually transmitted diseases, cancer, heart disease, and stroke. These were chosen because their prevalence is high in this area. As mentioned before, the 3 most prevalent diseases in the St. Petersburg area are STDs, with chlamydia being the highest. Breast and lung cancer cases are noted to be higher than at the state level, and incidents of heart disease and heart attacks are also higher than at the state level. West St. Petersburg is abundant in parks, community recreation centers, and fitness facilities. There are multiple yoga, boxing, martial arts, and private training locations. There are 2 local gymnastics and swimming gyms. And if any of these options are too expensive for the average residents, the YMCA is one of the 4 gyms offered in the area, which can provide scholarships to low-income families. The recreational centers provide multiple sports complexes, classes, gymnasiums, pools, and camps. The parks in the area are clean, well-kept, and a few even have lighted sports complexes for nighttime events. The area is definitely not lacking in environmental recreational activity, which could help address the county's sedentary lifestyle statistics. Pinellas County has a very thorough evacuation plan for disasters. The West St. Petersburg area alone has 4 fire departments that also respond to this area. There is multiple community programs that are offered by the police, EMS, and fire departments. Residential trash collection and recycling is offered by the county. There are also multiple waste drop-off sites in the area for recycling electronics and large debris. Outdoor rodent and animal control are offered by the city as well. Water and air quality are both within satisfactory range with no violations. Environmental resources overall are adequate. The only area noted to be lacking is the sewage system, which has been inadequate for a number of years without any long-standing solutions being found. This issue is not only a potential health hazard, but also a financial burden. Millions of dollars were spent last year alone on fines accrued from the sewage failures.
The mayor and all officials are elected every 4 years and are limited to 2 consecutive terms. The legislative body consists of 8 city council members representing each of their own city districts. This allows for equal representation throughout the majorly diverse area. There are also a number of councils and departments to assure the city is well managed in all aspects, including Community Services Department, Cultural Affairs, and the Downtown Enterprise Program. This facilitates to manage the rapidly growing downtown area. This city prides itself on diversity and giving opportunities for growth. City meetings are posted weekly on the city's website, as required by law, and they are open to the public. And the council members expected to be at each meeting are posted on the website as well. Most city meetings are recorded and put on the city website. The meetings are well attended by community members and are accessible to wheelchairs and other needs. An issue identified was the budget deficit for last year, which exceeded $6 million. Some of the suspected reasons for this was the continued money pour into low-income areas and ongoing sewage system issues that have been causing millions of dollars to be wasted on fines and troubleshooting solutions. More specifics regarding the budget and its possible shortcomings will be covered in the next slide. The new mayor, who was elected last year, has spoken about the budget and utilizing it more effectively to assist the community with its needs. Poverty is seen as the top priority problem in St. Petersburg due to the fact that 1/3 of its population is living below the poverty level line. An individual living below poverty level is a problem that can contribute to a number of other community issues, such as being less likely to receive a college education, being less likely to be able to make healthy choices and lifestyles, being less likely to be able to contribute or give back to society, and being more likely to live in the lower income neighborhoods. According to the Center for American Progress Action Fund, kids growing up in below poverty level situations will be less likely to contribute to their society and economy. The budget is the second priority problem identified because it also affects the entire community in a number of ways. Not only was there a budget deficit of over $6 million, but looking at the division of the money, the budget could probably be handled more effectively. For example, 50% of the overall budget went to salaries and benefits for city employees. Just over $35 million was put towards the debts accumulated from the water system issues and dealings with companies that went under during the market crash. And as of now, that state consent decree stands at $326 million. Only $1.2 million of the budget was put towards the funds that would address neighborhood conditions, even though this issue has been ongoing for many years and the city continually says that they are working towards a solution. On top of these standing issues, plus many others, the city still strives for grand projects like the new pier, which received over $40 million from the public service tax debt. As stated prior, the hope is that the new mayor will be able to enforce some change to help the community like he has promised. The sewage system is the third identified problem. As stated prior, the sewage system has been unsatisfactory for a number of years. With hurricanes and heavy rainfall being a fairly common occurrence annually, the issue is one that needs to be resolved. The health hazards, fines, and destruction caused makes this issue a high priority. Not holding a college degree is another problem noted. Only 42.1% of the population hold a college degree. A college degree pays off financially for the student as well as for the society at large. Obtaining a college degree holds a wide range of possible opportunities and effects on the community for not only the current generations but those coming after. Parents with a college degree are 3 times more likely to read to their children, making their children better prepared and excited for education, as well as creating an important bond. Having only a high school degree versus a college degree means that that person will be 8 times more likely to depend on government assistance. A college graduate pays an estimated 80% more in taxes than high school graduates, which in turn can contribute to the society as well. The low-income neighborhoods and areas are the 5th identified problem. As mentioned prior, some neighborhoods are in need of immense assistance both financially and structurally. USF St. Petersburg did a study on the area's ongoing problem and found direct correlations between neglected yards and living situations with income and renter versus owner occupied residents being contributing factors. Their suggestions included financial incentive programs or neighborhood yard transformation programs with labor being executed by volunteers. These options can both be cheaper than the current attempts. But the city government does indicate they hope to try more ideas to improve the situation, but the residents usually take that promise with a grain of salt, as this issue has gone on for a number of years with no change. The last community issue noted was the high incidence of lung cancer and the possible correlation to the high number of cigarette smokers. According to the Florida Department of Health, there is a higher incidence of lung cancer in Pinellas County compared to the state, 44.8% versus 40% respectively. There is also a greater incidence of cigarette smokers in Pinellas County versus the state, 20.3% versus 15.5% respectively. Smoking cessation and lung cancer prevention could be of benefit to this community. This problem is prioritized last because the issue appears to be isolated to the smokers specifically. Because the air quality in St. Petersburg has been and continues to be satisfactory, there is no evidence to support that this issue would go beyond the smokers and those possibly close to them. This concludes our presentation. Thank you so much for watching.